this part of the press conference, quite frankly, goes with the first part, because it's how we respond to this part that will determine at what point in time our kids return to school, hopefully this fall. The Houston Health Department today is reporting 325 new cases of COVID-19, bringing Houston total to 42,202. So that's 325. And even though the number is relatively low to the numbers that we have been reporting over the last couple of weeks, if not more, let me simply say you have to really look at that 7-day sort of total. And a lot depends on when we get the results back from the various labs. But today, 325 new cases. Sadly, however, we are adding 9 deaths, bringing the city's total to 400. Of the 400 total deaths, 89 are associated with nursing homes and 3 are associated with the Harris County jails. So 9 deaths are being reported. And again, this almost sounds somewhat sterile when you make mention of it, but each one of these persons come from families with loved ones, friends, and so 9 families that will be permanently impacted. So that brings our total now to an even 400. Each death is listed on the monitors in front, on the side, but I want to highlight 3 deaths of Hispanic men in their 40s and 50s with no underlying health conditions. And again, in their 40s and 50s with no underlying health conditions. 6 of the 9 happen to be Hispanic. And the point is, the virus is still spreading in our community and is having a devastating impact on the Hispanic community and the city as a whole. To put this in perspective, let me also say that in the month of July, in this month alone, we have had approximately 22,000 people who have tested positive for COVID-19, 21,911 specifically, as you can see. And I want us to see the progression of this virus in our community. In March, we reported 377 cases, people who tested positive. In April, you can see that number is right at 3,226. In May, 3,793. In June, that number jumped up to 12,865. And today, in July, and this month is not yet over, 21,911. So you can see the progression of this community spread just in the month of July. Now take a look at the number of people who have died within our city. And on this particular chart, you can see in March a total of 4 people that died as a result of COVID-19. In April, the number was 52. In May, the number went up to 73. In June, it went up to 95. And as of today, again, with several days left in the month of July, that number now is 176. 176 out of 400, almost double just in the month of July alone. It reflects that there is significant community spread, and it reflects the fact that more people are continuing to die as we proceed. What will be needed in order to slow that progression, to stop the number of people who are dying, is that we must collectively, not individually, put on our mask, social distance, practice proper hygiene, and take this virus very seriously. Now, let me also say, if you are feeling ill and getting progressively worse, do not wait to go to the hospital or seek medical attention. Give yourself a chance. Give the doctors a chance, the hospitals a chance, in order to attend to your needs. So if you're feeling sick and you're getting progressively worse, Don't wait until you just get so bad that it becomes very difficult to get the necessary care, medical treatment that you need. At the same time, let me speak to those younger individuals who are going out and about and returning home to your family members, to your parents, or to your grandparents, because there are multiple generations and families in our community, especially in communities of color. There are multiple generations. So to those, that younger population out there, please be mindful that you can bring this virus back to your family members, to your parents, or to your grandparents. So do not think that you're so strong that you cannot be a carrier, and even if you're feeling well. To the people who are at these events, these establishments, for example, of the weekend in large numbers, without your mask on and not engaged in social distancing, let me encourage you to take this virus very seriously, okay? Because the reality is, in this city, more people each month are dying as a result of this virus, and more people are testing positive. The faster we get the virus under control, the faster we can get things back to normal in our city, state, and throughout the country. And I want to stress to people, if you are feeling sick, do not wait until it's too late to go to your doctor or the hospital. Also be mindful that we are seeing cases being spread amongst family, especially in households where children, parents, and grandparents are living together, and they do not have room for social distancing. And if that is the case, I want to encourage families to wear their masks inside the homes to protect your loved ones, especially if you've been to places where people were not engaged in social distancing and did not have on their masks. I want people to get complacent, because the number of positive cases today in many of our hospitals may appear to be going down. The reality is that the numbers, we may have plateaued in terms of the numbers that we're getting to the hospitals, or it may appear to be that the numbers are coming down, for example, in the hospitals. But the reality is, and what my primary concern is, what's taking place in our communities. And the numbers in our communities are continuing to be increasing, and the virus still is running rampant. So we all have a part to play. I'm going to continue to ask us to take this virus very seriously and to govern our behavior accordingly. It is about changing behavior. And I know this is the summertime, and I know people are antsy and they want to get out and about, but until we can get this virus in a manageable position, then we're going to continue to be saying the same thing over and over again until people simply get it, and then we can put all of ourselves in a much better position. Now let me yield and let me bring up Dr. Persse.
Thank you, Mayor. We've got a couple of slides to show. We're going to talk about on Fridays, we calculate the positivity rate, and we announce those on Mondays. And so one of the things is this chart that's coming up here now, you're going to see is the number of cases of that are tested positive and those that tested negative, and then we've calculated the positivity rate. And so you can see that as of last Friday, there's a chart there on the right-hand side that shows you going back several weeks, back to early May. You can see that the numbers were rising and peaked at about 25.9%. We have seen a slight decrease. It is down to, as of this past Friday, 23.3%. So that's a little bit less than a 3% drop, not a huge drop. Also recognize that when you look at the yellow and the red bars, that there's a little bit of a lag. So in 2 weeks' time, when we look at those bars will be a little bit higher. And we will, of course, recalculate the positivity rates as we go on, as we get more data coming in, but that's a little bit of the lag effect. So those bars make it look better visually than it really is, so don't be misled by that. The positivity rate is the number that you need to focus on, which is still 23.3%, which is extremely high. So it goes to the mayor's point that the positivity rate in our communities remains very high. When we look at these, we locate the cases that are positive by zip code. We have our zip code map that shows, and again, if you look at the legend there, those zip codes that are in white, that does not mean that there's no virus there. That means it's less than 20%. And it's because there's so much viral spread. In order to make a differentiation, we start at 20 and we go up to the darkest blue means greater than 30%. And there are plenty of zip codes where the percentage is greater than 30%. So a couple of things. This shows where people reside. This is their homes. This does not necessarily reflect where they may have contracted the virus. Secondarily, I want to reinforce that those neighborhoods, those zip codes that have lighter colors or are colored white, that does not mean that there's no virus there at all. It just means it's less than 20%. And even 20% is a very high value. So I just wanted to bring everybody up to speed on that. And again, if you look at these maps week over week, you will see that there is some change from zip codes a little bit. If we go back several weeks, it looks quite a bit different. And that's not a big surprise from an epidemiologic standpoint either. Let's talk a little bit about contact tracing. We've got some data on the contact tracing. We now have got the contact tracing. We're up to just about 300. I think we're just a few people short of 300 in our contact tracing. And this is a little confusing, so let me walk through this slowly. So what this shows is that in the week of July 16th to July 22nd, there were 5,823 cases of coronavirus, new cases of coronavirus reported to the Houston Health Department. This comes from all of our reporting sources, not just our own testing sites, but all testing sites across the community within the city limits of Houston. So 5,823 new positive cases were reported in that week. We had complete contact information and reached out to 5,215. So our goal has been 85%. So from that standpoint, we did well. Remember, reaching out may be through a text message, it may be an email, or you may get a phone call, depending on what information we had. So we were able to, for everyone that we had the complete contact information through, we did reach out to them. Now, in the next meter shows that of all those positives that we got, unfortunately, only 4,042 of them were within a 10-day period where it was therefore actionable. If it's beyond 10 days, there's really not actionable information. And we were able to reach out and establish a relationship with so that we can continue to follow 2,769, which is only about 68.5%. So that's frustrating to us. And some of this is because people don't want to engage with us. Some of it is because, well, that's basically what it mostly is, they didn't want to engage with us. We did reach out to them, either electronically or by phone call, and they either chose not to respond to us or they did respond, but they didn't want to give us enough information. So that's both good news and mixed news, I would say, with that. And the other thing I just want to reinforce what the mayor said is that, and we've talked about this many times, is that when we can't, well, we as a community can get ahead of this virus by doing the things that the mayor has talked about and that we in public health have been talking about. But in order for us to get to we're in a mitigation phase now, in order for us to get to the point where contact tracing can really get a hold of this virus and stop it, we have to drive the numbers way down. So when we do reach out to you, and here's the information, when you get the caller ID, it'll be that number, 713-853-8700. That should come up on your phone now. We've got it so that should come up and say Houston Health. So if you get that call and says Houston Health, please answer the call. If you get an email from Houston Health Department at qualtrics-survey.com, that says, please look at that email, answer the questions. Or if you get a text message from the numbers on there, 35134-73940 or 39242, those are us sending text messages to you. Please respond to those, because that's how we're going to be able to find out who you, because we're going to be reaching out to the cases, that's how we're going to find out who you may have inadvertently contaminated or infected, and that's how we're going to be able to stop this virus from a containment standpoint.
Thank you, Dr. Persse.